Firstly, thank you very much for inviting me to speak today. I do have my notes. I'd love to do it like I do in the movies where they chuck them away and give her a really profound and moving speech. I can't, I need me notes. So bear with me with that. So today I am going to talk about the prevention and management of anxiety. But firstly, I just want to highlight that anxiety is a perfectly normal thing that I'm sure many of you will have actually experienced. And as such, you can't ever really prevent it. So that prevention's a little bit elusive. I'm also going to talk a little bit wider than just anxiety. I'm going to talk about fear, worry, uncertainty, depression, all of those things that go along with anxiety. To do that, I am going to use a lot of images and direct quotes that people who have been affected by melanoma have shared with me. So it could be quite emotional and it might end up actually inducing anxiety in some of you. So if it does, I do apologise for that. So everyone in this room is here for the reason that we have all been touched by melanoma. We know how serious it is, and we know that it isn't as straightforward as just being able to cut it out. Melanoma is so unlike any other cancer that's out there. The progression and the symptoms are so different for malignant melanoma. No two look alike and no two behave alike. On top of that, melanoma is predominantly caused by UV exposure. So people are having to live with that on a daily basis of how to go out in the sun and deal with these anxieties. It's not a choice that you have to make. You can't just stop going in the sun like you would quit smoking. It's not something that you can go and actively avoid. And because of that, the impact can be really profound and long-lasting. And that's what makes melanoma psychologically distinct than any other cancer out there. And on top of that, you've got the fear of recurrence, the worry, the anxiety, the distress that goes with just being diagnosed with cancer. Unfortunately, there is a general lack of understanding, awareness and acknowledgement of melanoma as a cancer, both within the general public and within the services that are out there. There is a general lack of service provision for melanoma. The number of dermatologists, oncologists and cancer nurse specialists who have specialist knowledge of melanoma is severely lacking, as are the support services to support both patients and, of course, family members. There is a severe lack out there that are tailored towards melanoma. So when I talk about anxiety, these can be really physical symptoms. So it can be things like headaches, nausea, shortness of breath or palpitations. You've got your changing in eating patterns, changing in sleeping patterns even. Or it can be things like being irritable, overly thinking and worrying, feeling disconnected from your surroundings and those people that were in it. That race in mind where you're jumping from one thing another to another to another and to another. Plus so many more. Now I'm going to quick raise of hands and see who's on the toes. So if you're either a patient or a family member, can you just raise your hands for me? Since being diagnosed with melanoma, who has been affected by anxiety? If you keep your hands up if you have been affected by anxiety in any way. That's pretty much everyone who had the hands up. So, anxiety is prevalent within this room and certainly within the melanoma community. But what's that telling us? That's telling us a percentage. It's not telling us what's caused that anxiety, what that means to each and every one of you and every other person who has been touched by melanoma. And it doesn't then tell us how people are impacted by that anxiety. So that brings me on to my PhD. So for this, I actually wanted to go out and try and answer some of those questions, find out how it does impact people. So in order to do this, I've used photos and interviews. I didn't want to limit responses by using questionnaires. I didn't want to go in with a list of my own questions from my own agenda. I wanted it to come from you as individuals and to capture your real experiences and what it's been like for you. So the photos that I've used have enabled us to do that. People have been able to capture what is important to them. And then through the interview, we have been able to talk about things that I wouldn't have even thought of. And we have been able to gain so much more depth and insight because of that. 29 participants might not sound a lot when we've been talking about thousands and tens of thousands of people for some of the other speakers. But for what I've done, it has been actually quite considerable. And it has ended up giving me 60 hours of interview data and almost 500 photos, which is quite substantial for me to go away and work with. The participants that I have spoken to have been diagnosed through from 2010 up until last year. And a few of them have actually been within a couple of months of being diagnosed as well, so I have got the broad range of perspectives. As you can see from the various stages in there on the screen, I have spoken to individuals across every stage. The most interesting part is 8 people didn't know what their stage was. Is it surprising? No? To me it was. I thought it was something that you would just inherently know. Some people couldn't because they couldn't remember because it was 8 years ago. Others had been told the depth, they'd been told about ulceration, but then not what stage they were at. Or worse still, the GP had done the initial biopsy, then there'd been miscommunication with the hospital so that they'd never been told what their staging was. So there was these quarter of people that I spoke to that didn't know what their diagnosis truly meant. They were so ill-informed about what they were going through. I'm now going to talk about some of the common themes that have come out of my research. So these are the things that can either cause our anxiety or the ways that anxiety can impact your life. It may be that some of them do relate to you. You might be able to relate to all of them or none of them. It's just representative of those 29 people that I've spoken to. So firstly, you can't ever overlook this medical focus. So whether it's going for scans, biopsies, sentinel lymph node biopsies, and that list can go on and on and on. It can become so all-consuming. It can make your life about that next clinical visit. But on top of that, you've got the uncertainty of what's going on, of not knowing, having these questions to ask, potentially not knowing who to ask because you're having to speak to several different people, or being so overwhelmed by all the information that has been given to you. And it's just so many thoughts and emotions that go with that, and it is a real roller coaster, and that can have quite a long time to process it and come to terms with what is going on. Plus, it can be quite traumatic to go through. So, looking at these, some of it might have actually induced that anxiety in you as you remember your own diagnosis, your own treatments, and the scars that you have been left with as a constant reminder of what you've been through and what you are still going through. Many of the people that I spoke to just went to their GP and then got referred with something that just didn't look quite right, to be told it's suspicious and a biopsy is needed. If you then fast forward that to needing a wide local excision, skin grafts, further treatments, enrolment on a clinical trial, all from something that didn't look quite right, something that could have looked as innocent as a bite or a freckle even. That is a really complex thing to have to come to terms with, and again, can take a long time to come to terms with if you ever do. Those surgeries that I'm sure you will have all had are taking away more than just your physical body. It's taking away more than just the cancer. As this quote on the screen illustrates, it's chopping bits of you away, mind, body and spirit, and that's relentless. It's changed who you are. It's created this new normal, this new version of who you are in which melanoma is now a part. Whether that's a big part or a little part, it is now who you are. And again, that can be so emotionally and intensively invasive, which is a mouthful. So again, if you look at these, some of you will immediately know what these represent. It's hearing the post come and you immediately start with the butterflies in your stomach and you're thinking, is it a letter from the hospital? What are my results? When's my next appointment? And that can provoke anxiety straight away. Or there isn't that letter from the hospital there. You're still in limbo, you're still waiting, you're still wondering, not knowing, and this uncertainty hanging over you. All of that, all those thoughts, feelings and emotions that some of you may well have experienced from the post coming. How many times do you get junk mail? But it's that kind of intensive way that melanoma can invade your life and provoke anxiety. These two pictures represent two different things. So for a lot of other cancers and health conditions, there's something you can take. There's a medication you can take daily to try and manage those symptoms, to stop it from getting worse. But with melanoma, there isn't anything that you can actively do. Yes, there's drug treatments. You can take your vitamin D. You can take your necessary sun protection precautions. But there's this lack of control and being able to actively do anything as an individual. This also represents the fact that there's still so much unknown about malignant melanoma. It is still, unfortunately, a second-rate cancer that, despite the medical advancements that have been made in the past decade that we've heard about over the past 2 days, it's still behind all of them. There's still so much more work to be done. Once you've been diagnosed with melanoma, you're told, keep an eye on your skin, check your skin. But when does that vigilance turn into paranoia, where you are constantly looking at your skin, you are checking and noticing things that perhaps you wouldn't have before? Has it changed colour? Does it look any different? And again, this can be all-consuming, especially as you're then walking around Morrison's checking other people's skin as well, which I'm assuming you've all done. But it's more than that. It's more than just looking at your skin. It's just feeling a little bit unwell or run down. And again, thinking, is that melanoma? Has it spread? Has it come back somewhere else? And that's the problem with melanoma. It is so sneaky that there's almost this constant question mark hanging over it. And again, it can pervade your life and be really anxiety-provoking. You have to have eyes everywhere all of the time. And so do your family members. They're taking on a responsibility to check your skin as well. And that is a really arduous and demanding task of them as well. So this next theme relates to how to live beyond melanoma. So I said at the start that for a lot of people, UV exposure could have been the predominant cause of it. So how do you then live going out in the sun? It's about what's safe, what's not safe, what can you do and what can't you do. Can you go and hang the washing out? Can you go and drive to work? Or do you have to be like a vampire, dodging into the shade and avoiding the sun? And as these quotes on the screen demonstrate, the actual living with the cancer can be more problematic than the cancer itself. There are so many different emotions that can go with such a normal thing as going outside. And the word cloud that you can see just in the centre there are just some of the different words that people have used to describe what that's like for them. So you've got things like sadness, trauma, panic, fear, loss. And again, it's this roller coaster of a different emotions and anxiety that's just due to the sun. And again, it's something in which real physical pain can be felt. And this isn't talking about people who used to love sitting out in the sun and sun worshippers, it's just going outside. And the quote on the right-hand side of your screen there, I do love being outside, and before this diagnosis, if the sun was out, I'd think, oh, it's a gorgeous day. It automatically makes me feel happy that that was a trauma, because all of a sudden, it's not the same feeling anymore, like I used to on a sunny day. That quote by itself just goes to show how much just the relationship with the sun can change, how much it changes just going outside. That beautiful sunny day with the happy emotions isn't beautiful anymore. Those happy feelings have turned into fear, panic, and anguish. But it's also having to think through every choice. So even something as simple as taking the dog out now requires thought and planning, to perhaps even avoiding social situations because of this really intense fear. Your family and friends also have to make these changes as well, or they don't make the changes and you end up losing relationships because they don't understand the struggles that you are going through. And as I've said, it's profound, it's intense, and it's very real, and these can all be life-changing things. Now, I'm sure over the bank holiday weekends in May, or even more recent than that, you will have seen either on social media the photographs of sunburn. You'll have seen the comments, you'll have heard people saying about going and getting a tan. It's quite insulting when you have been so personally affected by it. And there's this general flippant attitude toward being safe in the sun, and unfortunately then towards melanoma and the people that do take those sun precautions. It's something that's humorous. It's something to be made a joke of. Melanoma isn't seen as a real cancer by many. It's just some dodgy mole that's been removed. So because of that, a lot of people disregard the severity and struggles that people are going through, especially when you don't look sick. You don't look like a traditional cancer patient. So the very real impact that I'm sure some of you will have experienced is unfortunately overlooked, and you can be pushed into continuing your life pre-diagnosis, to going back to work before you're ready, or again, losing relationships because of this disregard, because of this lack of understanding. And I know a lot of people that I've spoken to have been told, you're being dramatic, you're just being over the top. It's just some dodgy mole because Joe Bloggs down the street had one removed and he's fine. So that automatically means that you should be. Or worse than that, Susan at work had breast cancer and that's the real cancer. So again, this diminishes what people who are affected by melanoma are experiencing, and this can create even further psychological problems as they don't take the necessary time that they need. In the UK, we have this general mentality of when we get a bit of sun, it should be sun's out, guns out. I actually wanted to put a picture of Channing Tatum with his little vest on there, but I thought it might be distracting. It's that generally you should wear as little as possible. You should be sat in the sun in the beer garden. You should be sat out in the garden getting a tan. But people who've been affected by melanoma, they're the ones that are covered up. They're liberally applying sun cream. They're wearing hats. They're the ones sat in the shade. And because this behaviour isn't normal, they're looked at as odd. They are judged because of that, because they are protecting themselves, as we all need to. And again, because of this, going outside and engaging in just normal routine life can again provoke great anxiety because of the social norms and constraints that we live in. Melanoma is a real cancer. The psychological impact of it is profound, varied, and long-lasting. The number of people who have said to me that they don't feel like they can talk about it, that they can't access the services because they feel like a fraud, because all they've had is a bit of surgery. Regardless of the stage you have had, regardless of the treatments you have had, if you are experiencing anxiety or other negative emotions, then go and talk about it. Go and access services that are out there, specifically tailored towards melanoma patients and family members. And again, there's other ways that you can try and manage it that are as simple as just writing or doodling down your thoughts. You can chuck these away, or you can keep them to try and have that conversation with your loved one who doesn't understand, with your co-worker who's just like, yeah, get on with it. Online, there are a plethora of different mindfulness techniques, guided imagery and breathing exercises. If you are experiencing anxiety, I'd go and say try them, but there's not one size fits all. Anxiety is a very personal thing, so it's about finding what works for you personally. My next step is to develop the use of photos into a therapeutic and clinical tool. as a lot of the people found taking photos to be quite therapeutic and allowed them to reflect back on their thoughts and feelings throughout the process. So I want to develop that specifically for melanoma patients. But I also want to use it within clinical settings. How many of you feel that your clinician doesn't quite understand you, doesn't quite get the struggles that you're going through? So by taking this photo, you can start that two-way conversation. They can answer questions that perhaps they wouldn't even thought of, and they can best support you in any way that they can. And of course, it's okay to not be okay. There is going to be times when you're going to want to rant, rave, scream, cry, and then other days will you be fine. All of that is perfectly normal thing to go through. I just want to say a quick thank you to everyone who did participate in my research. It has been absolutely invaluable, and hopefully I will be able to take it further. Just briefly as well, thank you to Melanoma Me, who have supported me personally throughout this and for helping me with the recruitment. So thank you very much everyone for listening.